So let us begin with Ellen's keynote study streak for today, and we are discussing a few remedies which act profoundly on the female reproductive system. We have discussed remedies like crocus sativus, ustilago, trillium pendulum, thalaspi bursa pastoris, and also sabina. So today we'll take this further and we'll talk about Helonias dioecia. So we'll see what the problem is in one of the live sessions. Yeah. So the first line what is mentioned for Helonias in Allen's keynotes says that it is suited for women with prolapses from atony innervated by indolence and luxury. So those who don't have any physical exertion, those who don't have any much stress, and they are living in the confines of their home without any botheration for the outside world, botheration for little issues that you know how the other people are bothered about. That's where you will need to give Helonias. So we'll block a few people who are putting spam on the account and so Helonias is a medicine which we should use in cases where you will require, you will get the details from the people, from the women especially, who will tell you that there is lack of exercise done, they are not much stressed, and they are living in the confines of their home and they are very much happy living what they are doing that. So this is one phase. Other phase is that they are worn out with hard work, mental or physical. So some state of women who are also overexerting themselves beyond their capacity, there can be extremes in one remedy, and that's where Helonias will be useful. Overtaxed muscles and burn and ache, so tired that they cannot sleep, that's what would help you give Helonias. Restless, must be constantly moving about. So those people who constantly want to do some work or the other every now and then, they cannot rest in one place. They need to be keep on cleaning the home, cleaning the surroundings around themselves. They are constantly diverted to work for that. That should be uh, give you a thought that it's not actually fastidiousness, but it's actually a restlessness of the person, which is telling you that they should be given Helonias dioecium. Right. Okay. So Irritable fault finding cannot endure least contradiction or receive least suggestion. This is the same the situation with anacardium. So people who do not want suggestions from other people around them, that will be one situation. Another will be constantly critical. They will be constantly shouting at other people. That should be your way to think about Helonias. You can take a few rubrics in the repertory. You will be misled to prescribing some bigger remedy. But if the lady is reporting to you with menstrual complaints or female reproductive system disturbances, and she is restless, she tells you that she constantly needs to do some work, she is very much irritable, fault finding, you will land into giving nux vomica or sulfur will come in your repertorization. Helonias will not come because it's not so strongly represented in some rubrics. Then you can go back to your materia medica sources and you will find that Helonias fits the bill perfectly well. Helonias will also be indicated in profound melancholy, deep and mental depression. So all those women who are also in their 30s, 40s, middle age crisis, they will report to you with some complaints. That should be your way to prescribe Helonias. Always better when occupied, when not thinking of the ailment. Calcarea phos, oxalic acid. You can confirm this from the patient. You will get it very easily. In urinary system, you will see that there is albuminuria, acute or chronic during pregnancy. Concomitants are that there is great weakness, languor, inability to do any work. They want to do all the work, but they are not able to do any work. Emaciation, irritability, and melancholic nature. Constantly they are good and bad. Sometimes they are very much good, sometimes they are very much bad in their behavior. So always whenever you have patients who are reporting to you with weakness or debility, get their urine checkup done. You will get a lot of interesting facts from their urine routine. Albumin, if it is present, you can think of Helonias. You can, if it is a case of a woman, you can think of natrum sulf, you can think of sulfur, you can think of phosphoric acid also. You will detect those things early and you will be able to give them good relief in the early part of their disease rather than progressing into pathological changes and causing much damages later on. You see that there is mentioned in Allen's keynotes that it is essential for diabetes first stages. Urine is profuse, clear, saccharine, lips dry, stick together, great thirst, restlessness, emaciation, irritable and melancholic. So someone who reports to you that I am just recently detected with diabetes and I have all the common symptoms of diabetes mellitus, how do I proceed? That should be uh, giving you a thought that Helonias can be indicated if there is restlessness symptoms like arsenic, lot of weakness, lot of critical nature, wanting to clean everything neat and tidy. Helonias is one of the remedies that will relieve them very easily. Menses too early, too profuse from uterine atony. In women enfeebled by loss of blood, when patients lose more blood, then it is made in the intermenstrual period. So many times you will have women who tell you that the bleeding is exceptionally more than what normally it was. Helonias can be one of the remedies which can be thought in some such cases. The breasts are swollen, nipples painful, tender, like conime, like leccan. All the cases which require these remedies, Helonias, magnesium, conime, leccan, will have troubles of the mammary before menses. If you have those remedies in your mind, whenever the patient will report to you, you will be in an easy and quick mode to confirm those remedies and prescribe them. The flow in Helonias is passive, dark, clotted, and also offensive. Sensation of soreness and heaviness in the pelvis. Lapa is another remedy which you can think, especially you can think Lapa in cases of prolapse of uterus. A consciousness of the womb as if it is so sore and tender, feels it is moving when she is also moving about. So many women would tell you that whenever there is movement, they feel that something is moving inside the lower abdomen. I feel there is gas, I feel there is some movement. Helonias can be thought. Thuja is also one of the other remedies that can come into mind if such presentations are faced by a homeopath. For the bad effects of abortion and miscarriages, Helonias can be thought. Compare this remedy, Helonias, very strongly with Elatrice farinosa, which is a very good remedy for nutrition related problems and a long term illness which has debilitated especially the female system. Ferrum metallicum is another remedy, Lilium tigrinum is another remedy, and phosphoric acid. So, to understand Helonias, if you have a case which has lot of weakness, lot of restlessness, anemic person, lot of hemorrhages, and always wanting to be busy all the time, think of Helonias. The comparison of the remedy is with Elatrice, Ferrum, Lilium tigrinum, and phosphoric acid. All the four remedies are weakening the nervous system, and yet because of in spite of the weakness, it wants to do the work to fulfill the need of the family. That will be Helonias for you. There is another similar remedy which many of the similar cases will report to you, and the remedy which we will discuss today, the second remedy will be Murex. Persons of melancholy temperament, they are good sometimes, sometimes they are very much bad. Bad means they would probably be happy and weeping at times. Sinking all one sensation in the stomach like sepia, one of the top remedies we should think of in cases where there is lot of weakness, lot of sinking feeling in the stomach. For the sufferings during climacteric, cases sepia, sulfur are to be thought of great depression of spirits. They will constantly report to you that they are very much sad in this phase of climacteric, or else at times they will not be overt and tell you that they are sad, but they will tell you that these situations made me sad. Patients do not want to claim that their emotions are generated by themselves, but they have become that person because of the situation around them. If you find this correlation of person becoming sad whereas earlier it was she was not, and it is a climacteric phase, think of Murex provided other symptoms are matching. What are the other symptoms? The least contact of parts will cause intense sexual excitement. Female homeopaths can confirm this from the female patients. And if there is violent excitation in sexual organs, excessive desire for embrace, you can think of Murex. This is exactly opposite of sepia. So these two remedies are poles apart. And what you will see in Murex, similar to Helonias and Lycinum, is sore pain in the uterus and a distinct sensation of womb. There is a constant feeling that something is moving around. Thuja also has this sensation we discussed, and a sensation that there is something which is bearing down or pressurizing the contents of the uterus outside. Lilium tigrinum is one of the top remedies that the patient will always require. Think of Murex also, think of sepia also in such cases. In Murex, it is that the patient needs to again sit cross-legged and to ameliorate the pressure, but it feels better to some extent, but there is lot of sexual desire which will indicate Murex, but sepia will not have lot of sexual desire. Many times patients, if you have female homeopaths with you, the male homeopaths, you have female homeopath as an assistant, or if you have a relative who can confirm these symptoms from the patient, you can get it very easily. Female homeopaths can try to cross check with the female patients and get it very easily. Mens is irregular, early, profuse, protracted, and large clots in Murex. Leukorrhea is aggravated by mental depression, and the patient is interestingly opposite happy when the leukorrhea is worse. So this is a very opposite and contradictory modality. Compare this remedy Murex with Lilium tigrinum, with Platina, and with Sepia in bearing down sensation. If you are thinking of remedy for patient who has prolapse of uterus or prolapse like symptoms, Murex can be one of the remedies that helps. One of my cases is improving on Lilium tigrinum. Another of my patient is improving on sepia. So you need to match the symptoms from the materia. For these smaller remedies, bigger remedies like sepia, Lilium tigrinum will be easily available from the repertorization because they are widely and very popularly proved. These smaller remedies will be less commonly observed, and you'll need to touch Allen's, Boric, Clark, and the different keynotes or different materia medicas to get the indications to prescribe them. So we come to an end for today's session of Allen's keynotes. We discussed two remedies, Helonias and Murex, and if you have used these remedies in your clinic anytime, do mention the case so that everyone is enlightened with this information. And uh, we end today's session to meet again tomorrow evening, same time with another set of remedies.